In 2017, nearly 58,300 people died in the U.S. due to leukemia, lymphoma, and myeloma. I have always been interested in new discoveries in cancer treatment because cancer is something that has affected many members of my family directly. I have read a lot of books and articles of recent discoveries in cancer treatment. One recent innovation in cancer treatment is cellular immunotherapy. Cellular immunotherapy is a groundbreaking innovation for cancer treatment that has less side effects than chemotherapy. First, I will discuss what leukemia and lymphoma are. Second, I will discuss the treatment of cellular immunotherapy. And finally, I will discuss the side effects of cellular immunotherapy. Cancer is sadly something we hear about on a daily basis and affects many people in our lives. Leukemia and lymphoma are types of cancers that progress gradually in the body and require treatment. One of the most common cancers that affects many lives is leukemia. According to the Leukemia and Lymphoma Society, leukemia begins in a cell in the bone marrow, and the marrow cell then undergoes a leukemic change. After this, the leukemic cell then begins to grow and survive better than the regular healthy cells do. The cells replacing regular healthy cells then grow and survive better than regular cells, causing these regular cells to diminish. Another cancer that affects many people is lymphoma. The American Cancer Society states, lymphoma is a cancer that starts in cells that are a part of the body's immune system. These cancer cells crowd the white cells, resulting in the immune system not being able to guard or protect against infection. These cells can gather in other parts of the body as well, where lymphoid tissue is found. Leukemia and lymphoma are types of cancers that affect the lives of millions of people. According to the National Cancer Institute, there were an estimated 24,500 deaths in the U.S. in 2017 due to leukemia. The American Cancer Society states about 20,140 people died from lymphoma in 2017. Treatment is constantly changing and progressing because so many people are being affected by this and so many lives are being taken. There have been countless attempts to treat leukemia and lymphoma, but a recent medical innovation, cellular immunotherapy, may drastically change treatment for these patients. According to a 2015 article from the Leukemia and Lymphoma Society, immunotherapy utilizes your own immune system to fight cancer, which generally results in less short-term side effects than chemotherapy does. Cellular immunotherapy involves taking one's own cells and modifying them to be able to fight off cancerous cells when put back into the body. This innovation could help many cancer patients avoid the harsh side effects of chemotherapy like fatigue, nausea, and even pain. There are multiple uses of immunotherapy depending on the case. The Leukemia and Lymphoma Society states, doctors use immunotherapy in several different ways to treat blood cancers, including in combination with other cancer treatment, as maintenance therapy after combination chemotherapy, or as a single agent. This shows that this treatment can be very useful to not only help cure people, but also prevent previous cancer patients from getting cancer again. This treatment promotes healthy cell growth and allows patients to be treated without the negative side effects that come along with chemotherapy. There are also many types of immunotherapy depending on the patient. According to the Leukemia and Lymphoma Society, types of immunotherapies include chimeric antigen receptor T-cell therapy, cytokine treatment, and radioimmunotherapy and monoclonal antibody treatment. Each of these treatments promotes the development of healthy cells. The most common treatments include vaccines to boost one's immune system to be able to fight off these cancerous cells. While immunotherapy has less side effects than chemotherapy, there are still some downsides. Chemotherapy has harsh side effects that make it hard to undergo for patients. According to the American Cancer Society, common symptoms of chemotherapy include fatigue, hair loss, infection, nausea, and even nerve and muscle damage. These are very harsh side effects that make the whole process much less bearable for patients to undergo. Patients can experience extreme sickness and fatigue, which can stop them from doing things that we do in our daily lives. No one should have to be stopped from living out their regular tasks every day. Chemotherapy also has potential long-term side effects. In an article from Fox News, the author states, the heart and cardiovascular system are also greatly affected by radiation and chemotherapy. Many cancer patients are at risk of getting cancer at some points in their life again, and when treated with chemotherapy, they are also put at risk for heart problems such as cardiovascular disease and congestive heart failure. With this being said, immunotherapy still has its side effects. According to the National Cancer Institute, side effects of immunotherapy include fever, chills, nausea, headache, and dizziness. Even though immunotherapy is not as harsh as chemotherapy, it still has its side effects like most treatments do. These side effects are still very minor compared to those of chemotherapy. In conclusion, I discussed what leukemia and lymphoma are, the treatment of cellular immunotherapy, and the side effects of immunotherapy compared to those of chemotherapy. Cellular immunotherapy is a groundbreaking innovation for cancer treatment that has less side effects than chemotherapy does. Tragically, thousands of lives are being lost to leukemia and lymphoma every year, but luckily many lives are now being saved due to cellular immunotherapy. Thank you.